Hello, and welcome to the Encore Research Group podcast, where we encourage community research and education with weekly podcasts. I'm your host, Benton Loeyball, and this week we're talking about chronic kidney disease. Let's dive right in. What is chronic kidney disease? Most of us have two kidneys. They're fist-sized and shaped like kidney beans. The kidneys filter blood, but it's much more complicated than it sounds. They filter all the blood in the body several times a day. They differentiate between proteins, cells, minerals, acids, salts, and water. They regulate the amount of small particles to filter out or retain, and they release hormones to regulate blood pressure, red blood cell count, and some aspects of bone growth. To do this, each kidney is packed with tiny filtering units called nephrons, from the Greek word for kidney. Blood goes into these units where it is separated and filtered by a structure called a glomerulus, from the Latin word for ball of thread. The filter has three layers which allow progressively smaller items through. The endothelium blocks cells and other large items. The glomerular basement membrane blocks proteins. And the narrowest filter is called the epithelium. It's made of special cells called podocytes, from the Greek word for foot. These look like octopi and use their many legs to form slits, which regulate what gets through. Water, sodium, minerals, and acids are all separated from the blood. The nephrons sense the levels of these items and excrete excess amounts along with waste products into the urine. The pressure across the filter heavily influences filtering, so the kidneys have a system to regulate the blood pressure in the nephrons. Unfortunately, when kidneys are deformed, damaged, or otherwise can't filter for a prolonged period of time, we are subject to chronic kidney disease. Chronic kidney disease, or CKD, is an enormous problem around the world. At least 13% of the global population, including 37 million Americans, live with chronic kidney disease. It is defined as an abnormality in structure or function that lasts at least 3 months and is a big driver of cardiovascular disease. In the early stages, people may not have any symptoms. In fact, only around 5% of people with early CKD are aware they have the disease. Advanced chronic kidney disease presents with myriad debilitating problems, including pain in the chest, changes in appetite and urination, headaches and fatigue, shortness of breath, skin issues, concentration issues, and more. Unfiltered blood can increase the amount of inflammation throughout the body. On top of this is the most dangerous effect, damage to the cardiovascular system. When the kidneys fail to filter effectively, blood clots become more common, blood pressure may change, and the heart and vascular system suffer. So what causes this to happen? Since chronic kidney disease is diagnosed based on kidney function and not cause, there are many potential culprits, and each patient will have different circumstances. Most risks can be divided into modifiable and non-modifiable. Modifiable risks may be managed through lifestyle or medication. 1/3 of people with diabetes have CKD. Diabetes may come with excessive glucose in the blood, which damages the blood vessels in the kidneys. High blood pressure, high cholesterol, obesity, and metabolic syndrome are all other significant modifiable risk factors. On top of these, heart disease can lead to renal failure, which unfortunately then leads back to more heart disease. Non-modifiable risks include age, family history, and ethnicity. Now let's go a little deeper. When CKD is diagnosed or staged for severity, doctors look at the kidney's output. They may measure the amount of albumin, a component of the blood, in the urine. High levels of over 30 milligrams in 24 hours indicate issues. They may also measure or estimate the glomerular filtration rate, or GFR. The average American starts with a healthy GFR around 118 milliliters of blood each minute, but someone with CKD filters fewer than 60. It can be conceptualized as the filtration rate of a single nephron times the total number of nephrons. And the GFR gives a good indication of what goes wrong in CKD. The number of nephrons decreases significantly. Before we're born, we have all the nephrons we'll ever get, around 1 million per kidney. This is more than we need, and a person with a healthy renal, which is Latin for kidney, function could donate literally half of them without suffering ill effects. We tend to lose nephrons over our lives, but the rest take up the slack. As nephrons are destroyed, the amount that each one filters has to increase. They try to grow and compensate, and they are often successful. With chronic kidney disease, the compensation fails, and the nephrons suffer compounding damage. High blood pressure in the kidneys can cause the filter to let in improper substances. It can also cause the podocytes to detach and clog the nephron. So what can we do? Despite a lot of effort, we have no way to clean the filters or regenerate nephrons, though scientists are trying. Current best practice is to mitigate the risks posed to the other parts of the body, especially the cardiovascular system. Anticoagulants are used to stop clotting in the bloodstream, but these come with the unintended side effect of making bleeds worse. So new anticoagulants that target things like FXI are being investigated to make blood vessels less prone to clots. Other solutions include mitigating inflammation, reducing the effects of excess albumin, and managing medications and complications that may cause a feedback loop with renal distress, like blood pressure and cardiovascular risks. Clinical trials targeting CKD are currently enrolling, so let's give unfiltered thanks to our kidneys. Thanks for joining us on this week's episode. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at encoredocs.com. That's ENCOREDOCS.com. Encore Research Group has been involved in clinical research for over 25 years. We have 7 clinical research sites across Florida, including 2 Phase 1 units. If you're in Florida, join us at sites in Northeast Florida and on the Nature Coast. If you're outside of Florida or South Georgia and are interested in joining a clinical trial, head over to clinicaltrials.gov. For more great content, including discussions by physicians and clinical research experts, check out the MedEvidence podcast. My name is Benton. Thank you for joining, and we'll see you next week.